The annual report, Ready or Not, Protecting the Public's Health from Diseases, Disasters, and Bioterrorism, was just released.
It's put together by Trust for America's Health. John Auerbach is the group's president and CEO, who joins us live to talk about how prepared we are for an emergency in Illinois. John, thanks for being with us.
My pleasure.
So this report card about, well, let's specifically talk about Illinois. Are you talking about how we responded to COVID or how prepared we are for the next emergency?
It's really a larger picture of how we're prepared for any emergency, COVID, but other types of emergencies too, be they weather-related emergencies, environmental. We need to be prepared for any kind of emergency that might affect the population.
And how are we?
Well, I think the results are mixed. What we see is that there's some areas where the state and the nation has improved over the years, but there's a lot of room for improvement, particularly as we think about how to strengthen the public health system and not just wait until there's an emergency to pay attention.
Okay, so I'm looking at your list, things we need to work on. Only 34% of our hospitals grade A for safety. Our vaccine infrastructure is weak and offering paid time off. What impact does this have on the system, these three things?
Well, they are, in fact, related to how well we can respond to an emergency, and we're seeing that now with COVID. So I'll use one example. The percentage of the population in Illinois who are vaccinated for seasonal flu. Only about half of the population that should get a vaccine. Now, what does that relate to an emergency? Well, we're now seeing with COVID, we need to be able to vaccinate the entire population quickly. If there is a well-functioning vaccination system that's used every year for flu vaccines, it makes it much easier to ramp that up to vaccinate for COVID. On the issue of paid sick leave, that's another issue that's very much related to COVID as well as other emergencies, because we know if people don't have paid sick leave, they go to work when they're ill, and that can lead to spreading an infectious disease.
So, John, let me ask you, there was a bipartisan report years ago saying, hey, you better prepare because a pandemic's coming sooner or later, and that thing just got thrown in the circular file. When you issue this report, what happens? What is the reaction? Do the mayors just say thank you, or what's supposed to happen?
Well, we pay a lot of attention to sitting down with policymakers at the local, state, and particularly at the federal level to say, let's learn the lessons from this. Let's strengthen the nation's capacity to handle any emergency. Right now, for example, we're working with members of Congress who this week have introduced a bill to increase funding for the public health infrastructure by $4.5 billion, not just during an emergency, but every year. We think this year there's greater attention being paid to what we need to do long term because we've seen the consequences with COVID of ignoring the preparations and the prevention efforts.
All right. Thank you so much for joining us. The report is put out by Trust for America's Health. You can find it more at tfah.org. Have a good day.
Thanks very much.
Thank you.